Hi, this is your Houston chiropractor, Dr. Gregory Johnson, and today we're going to be identifying and correcting through adjustments and therapeutic exercise shoulder problems. Many patients come in with shoulder pain. Some of the times that emanates from the cervical spine and the brachial plexus, but often that comes from an actual misalignment or subluxation of the shoulder joint itself, misalignment of the bicipital tendon as it goes through the bicipital groove, or, as most of you have probably heard, rotator cuff tears. So we're going to examine her shoulders first and foremost by doing just a range of motion, and this is considered a passive range of motion, which is where I'm taking her through there. Now, right there, at that point, we get a little bit of a restriction, but not bad. Now, as I'm doing this, I am feeling for crepitus or grinding, which she's doing pretty good there. Now, I'm going to do a muscle test. I'm going to push straight down. You hold real hard. Excellent. Good. Now, okay. What I'm going to do is straight out. I'm going to push down. You hold. Now, see, her anterior delt's a little weak. Now, we're going to go posterior, and I'm going to push down. Hold. Yeah, her anterior and posterior deltoid are a little bit weak, but her lateral deltoid is good, and her bicipital tendon was in the groove. So we're going to do exactly the same thing with her left shoulder. And I've been adjusting her shoulders now for a few weeks, so they're already better in their range of motion. Okay, now let's just go around this way here. Very good. She's got good range of motion here. Now let's test the strength here. Very good. She's very strong there. Anterior deltoid. And, oh, see there? Got a big loss of range of motion. Posterior deltoid. No strength at all. Hold up. Yeah, there we go. We got some crepitus on that one. So we've identified that she does, in fact, have left shoulder weakness. Now we're going to test her reflexes. Just relax that. Very good. Biceps reflexes, good. Triceps, or the brachioradialis is good. And so is the triceps. Okay, this is the biceps. Just relax that. Good. Brachioradialis and triceps is a little weaker on the left side as well. So what we're doing is identifying that she has a cervical brachial issue as well as weakness and crepitus in her left shoulder. So here's how we're going to treat that. I'm going to have you lay on your back for me first, Mary, with your chest over this. So scoot down that way. There we go. Excellent. The very first thing that we're going to do now is I'm actually going to adjust her AC joints and her clavicles. If you'll put your arms straight out like this for me, palms up. Okay, slide down just, there we go, perfect. Now, I am adjusting her AC joint bilaterally there. I'm adjusting the sternoclavicular joint on the left. The AC joint and sternoclavicular joint on the right, the anterior ribs that attach to the sternum. These are called costosternal subluxations. Now, we're going to give her a really good stretch, and what I want you to do is pull against me. Very good. Now, I want you to push up. Very good. Now push down against me. Push down. X, that's a little weaker. Now outward. Very good. And now inward. Very good. Now we're going to do this one more time. That left shoulder's giving us some problems. Push up again. You always do this with the patient in resistance. Very good. Now, let's set you back up and face that away one more time. And I'm going to adjust this left shoulder back into, just relax your arm, there you go. Very nice. You probably heard that. Now we're going to actually separate her glenohumeral joint. And let's just adjust this one for good measure. Okay, just look straight ahead. There we go. Excellent. Now, let's do these tests again. Hold this up again. Very good. Now hold. Very good. Now, look at the increased range of motion. I'm going to push down, hold. Much better. This is how you identify and correct subluxations of the shoulders. This is your Houston chiropractor, Dr. Gregory Johnson. We'll see you next time.